Good afternoon and welcome to our Women's Health webinar. My name is Chantal Dumas. I'm a naturopath and medical advisor with AOR. So women's health, as we know, is a very broad topic, and we will start by looking at some statistics surrounding women's health, and we will then look at an overall view of the hormonal cycle and our hormones, and we will look at certain conditions associated with estrogen dominance, such as premenstrual syndrome, hypermenorrhea, perimenopause, and breast cancer. Then we'll move on to menopause, and we will look at the main causes of hormonal imbalance, and also we will have a more specific look at the role of stress in this situation that we define as hormonal imbalance. And last but not least, we will look at different ways and solutions to achieve and maintain our hormonal balance, one of which is how to improve estrogen metabolism. Women's health in number. Canada counts a little over 17 million women and girls, which accounts for about half of the Canadian population. The average life expectancy for women in 2009 was 83 years old, compared to 79 years of age for men. The leading causes of death for Canadian women are cancer and heart diseases. And amongst the most commonly diagnosed cancer in women, breast cancer is definitely the number one. In terms of the reproductive cycle, the estimated mean age of menarche is a little over 12 years old. So by the time Canadian girls reach 13, they will have had their first period. The average age of perimenopause is 45 years old, and perimenopause is this period that precedes the official apparition of menopause, and it can happen anytime between the ages of 39 and 51 and last from 2 to 8 years, the average length being about 5 years. The average age of menopause for Canadian women is 51 years. And currently, there are 4 million Canadian women who have reached menopause who are undergoing this stage of their life. And it is important to note that menopause is actually a natural stage of our life. It affects every woman differently. However, it does not necessarily need to be medicated. And today we will look at some of the solutions that we can put in place in our lives in order to maximize our vitality in that period of our life and minimize the symptoms that we usually attribute to menopause. So hormonal balance is the stage where our hormones are in the proper ratios. So the estrogens, progesterone, and testosterone in our body have to be maintained in a very narrow range, and that is accomplished through a complex set of feedback loops that will determine at each and every moment how much of each hormone is being made in our body. And the communication takes place between the brain, the ovaries, and the adrenal glands, and they all act in concert with all our bodily systems. And this communication is really important because estrogen's fluctuation can have quite dramatic effects. It will affect how we feel, how we think, and how we function. That's why the body will put a lot of resources in place in order to maintain those normal ratios of hormones in our body. So let's look at the typical 28-day menstrual cycle. Day number 1 is the first day of bleeding. And the menstrual cycle can really range in length between, let's say, 21 to 31 days. But the average typical cycle will be 28 days in length. So the first phase of the cycle is what we refer to as the follicular phase, and it ranges from day 1, so first day of the bleeding, until day 14, which is normally when ovulation will take place. So in the first phase of our cycle is when each follicle in the ovaries, or that little pocket of tissue filled with estrogen, will release one follicle that will become dominant and produce a viable egg. And as these follicles ripen, the estrogen's level in our body will raise. At mid-cycle, the hypothalamus and the pituitary glands in our brain will release specific hormones called LH and FSH. And these two hormones will trigger the dominant follicle to ovulate, and our estrogens level will keep rising. So the ovulation will occur around day 14, and that's when really that dominant egg is released and will trigger a host of hormonal secretions in our body. And for many women, they will be able to feel when the ovulation occurs because they might experience abdominal twinge or nipple tenderness or specific vaginal discharge. And then the second phase of our cycle that extends from day 14 to day 28 is a phase where estrogen levels will slowly go down and where progesterone will normally rise up. And the fertility period is the 24 to 48-hour window that surrounds the time of ovulation. So in the second phase of our cycle, or in the luteal phase, the progesterone level will remain high unless the egg goes unfertilized. So if the egg is not fertilized, the progesterone level and the estrogen level will both go down, and that's what will trigger the menstrual period and a new cycle to start all over. So that's what normally happens in a typical regular 28-day cycle. Now, the cycles can last anywhere between 21 and 36 days, and it might be normal for some women. So if you always have a 31-day cycle, let's say, that might be your regular. In different periods of our life, the cycle will tend to have different variation, and one of this period is the perimenopause. So here we see the amplitude of cyclical reproductive hormonal changes. And if you look at the first peak that we see on that diagram is in our childbearing years, and it corresponds to pregnancy. So obviously we know that during pregnancy, the body undergoes a whole host of hormonal variations. And then the second peak we see, which is actually the most dramatic peak, is between the ages of 40 and 50, and it corresponds to that perimenopause period in our body. So usually the body will manage those changing levels of hormone throughout our lifetime. But when the changes are very dramatic, such as in pregnancy and perimenopause, the body might need extra support to stay in balance, and that's what we will look together into what to do to support those periods of changes. So some of the factors that will influence the regularity of our cycle is a significant weight gain or weight loss, eating disorders, poor nutrition, over-exercising. We're all familiar with certain athletes who will start missing periods because of overtraining. Caffeine, alcohol, smoking, medication, all these substances can have an impact on your hormonal cycle. And then there are certain conditions such as polycystic ovarian syndrome, certain uterine abnormalities such as fibroids and cysts, and different hormonal imbalances related to the perimenopause period. So in terms of hormones in our body, estrogens are the dominant feminine hormones. And we talk about estrogens because it's a family of hormones. So the main estrogens for female are estrone, estradiol, and estriol. And the dominant form of estrogen in our body is estradiol during our reproductive years. In postmenopause, estrone becomes then the dominant hormone. So hormones in our body, the estrogens per se, come from two different ways. They are the endogenous estrogens, so the ones that our body will produce naturally, and they are synthesized from cholesterol. And they are usually produced by our ovaries, except for during pregnancy, where the placenta will be the main producer of estrogen, and also by the liver, adrenal glands, and breast. And we will see that adrenal function is very, very important, especially after menopause, because it will account for more than half of the production of estrogens after menopause. Then the second source of estrogens is the exogenous source of estrogen. So estrogens that come from outside of our body. So the first source is what we call the phytoestrogens, and these come from dietary substances such as soy, for example. And phytoestrogens have also been termed selective estrogen receptors modulators, and the reason for that is because their molecular shape is very similar to the shape of the estrogens that our body produces, so they will have a limited effect on the estrogen receptors. Then the second source of exogenous estrogens is bioidentical hormone replacement therapy. Then we have conventional hormone therapy and xenostrogens. And xenostrogens are the bad guys. They really are, again, molecules that really resemble the estrogens our body produces, and they come from environmental sources such as plastics and pesticides. And because of their shape, they will act as major endocrine disruptors, so they will cause some damage in our body. The roles of estrogens and progesterone are very, very wide. As we see, there are more than 400 different functions that are attributed to estrogens. But in summary, we can say that estrogen have a proliferative effect. So what they will do is they will, for example, cause the endometrium lining the inside of our uterus to proliferate in order to welcome the fertilized egg. It will also cause our breast cells to be stimulated. It will increase body fat, but it also increases the risk of certain type of cancers such as endometrial, for example. Progesterone, on the other hand, has a balancing effect on estrogen. So estrogens proliferate, progesterone slows down the action of estrogens or counteracts the action of estrogens. So we see that these two hormones, because one has a proliferative effect and the other one has a slowing down effect, need to be in balance. However, there is a situation that is called estrogen dominance, and this term has been coined by Dr. John Lee in his first book on natural progesterone. And that situation of estrogen dominance refers to the condition where a woman can have deficient, normal, or excessive estrogen, but has little or no progesterone to balance its effect in the body. And what's very important to understand from this estrogen dominant situation is that even if a woman has very low estrogen levels, such as, for example, after menopause, the levels can still be imbalanced in proportion to progesterone, and so you will still have a situation where you are estrogen dominant. So even with low levels of estrogen, if your progesterone is even lower, you're still in this ratio of estrogen dominance. Some of the signs and symptoms that are associated with estrogen dominance, for example, breast tenderness, irritability, weight gain, water retention, and so on and so forth. And as we can see, a lot of these signs and symptoms are the signs and symptoms that are also linked to premenstrual syndrome and some of the symptoms attributed to menopause. Some of the conditions related to estrogen dominance are PMS, menstrual migraines, uterine fibroids, endometriosis, breast and uterine cancer, and hypermenorrhea, or this very abundant period. So we will look in more details to PMS because it affects 3 out of 4 women, and hypermenorrhea and breast cancer. So PMS really is an umbrella term that clumps together over 200 different symptoms. As I said, it will affect 3 out of 4 every menstruating woman throughout her lifetime, and it tends to peak in the late 20s and early 30s. The symptoms tend to recur in a predictable pattern, like women sometimes know to the date when they will have their monthly migraine, for example. And there's a very severe form of PMS that has been termed premenstrual dysphoric disorder, and that is a form that sometimes needs to be medicated, but for all other symptoms related to premenstrual syndrome, by and large, we can address them with a few modifications to our diet, lifestyle, and by incorporating some nutritional supplements. So some of the symptoms commonly attributed to PMS, we see that they range from emotional and behavioral to physical in nature. So for example, tension or anxiety, depressed mood, crying spell, and we go on the other end to like headaches and fatigue and weight gain, abdominal bloating, and so on and so forth. Now, why do hormones affect our brain is very interesting. Is because of this communication that takes place between the hormones and the brain. The brain functions as a master endocrine regulator, and it sends the dominant messages to the other hormone factories in our bodies. So the female hormones circulating in the body travel back to the brain to provide the feedback. And in most women, this process is a very smooth and minor one, where this crosstalk will occur very naturally and smoothly throughout the month. But in certain women, this crosstalk will disrupt the function of certain neurotransmitters such as serotonin in the brain, and it will interfere with their mood and cause more pronounced symptoms. So the symptoms of PMS can be managed with pharmaceuticals, for example, bioidentical progesterone cream, oral contraceptives, antidepressants seems to be the latest drug of choice to manage symptoms. And the key word here is manage symptoms, because the problem with these approaches is that although they may improve the quality of life of women who are experiencing them monthly, they will not address the cause of this imbalance in the hormones. So month after month, you will need to rely on that treatment. So what we're proposing you today is ways to actually address the root causes of the hormonal imbalance. So the second condition I would like to address with you today is what we call Menorrhagia or Hypermenorrhea, and it refers to abnormally heavy and prolonged menstrual periods that reoccur at regular intervals. Now, it is very normal for most women to have certain months where your periods will be heavier. For example, if you've undergone a major stress, or you've started training, or you're taking some detoxifying herbs, you may experience a heavier period. Now, to talk about hypermenorrhea, this situation needs to reoccur on a regular basis. And some of the common causes, well, the main one is definitely the situation of estrogen dominance, where you have low progesterone relative to estrogen in circulation in your body. And as we saw, it is very common in perimenopause. Fibroid tumors also can produce heavier bleeding, such as polycystic ovarian syndrome as well. Other hormonal imbalance might also create more abundant menstrual flux, such as adrenals and thyroid imbalance. There are also more specific causes that need to be investigated medically, but by and large, the most common cause is this situation of estrogen dominance. Now, one of the concerns with hypermenorrhea is definitely the presence of anemia, because if you're bleeding too much month after month, obviously you can become anemic. And in return, anemia may also cause you to bleed more heavily, so it becomes sort of a vicious circle. Some of the signs and symptoms of hypermenorrhea is when your menstrual period lasts longer than 10 days, when your menstrual flow includes very large clots, and this can be accompanied by lower abdominal pain and tiredness and so on and so forth. Perimenopause, as we saw, is this period leading to menopause, and it's an area of our life that is characterized by a diminished amount of estrogen and progesterone. So our body is slowly going on resting mode, and we're producing less and less hormones. Now, the main problem that occurs is that this diminution of hormones is not equally balanced between progesterone and estrogen. So between 35 and 50 years of age, because we start to experience those those cycles without ovulation, we produce less progesterone. And so what happens is the drop in progesterone is a lot more drastic than the drop in estrogen. So progesterone may go down by up to 75%, while estrogen is only going down by 35%. So obviously, we're going to have this situation of estrogen dominance where, you know, although our estrogen level is going down, it's not going down as sharply as our progesterone level. And this is very important because progesterone is a hormone that regulates the amount and the length of bleeding in our body. So that's why we see that during perimenopause, we will have those longer periods, and also they come closer apart. So the cycle will become shorter, and the menstrual flux will become heavier because of this situation of less progesterone to estrogen ratio. Now, in terms of breast cancer is a very scary disease for most women. As we saw, it is the most commonly diagnosed cancer in women. It is not the deadliest one. Deadliest one is pulmonary cancer, but nonetheless, it affects many, many women. So in 2007, there were over 21,000 new breast cancer cases in Canada. The incidence rate is very high, and what is more scary to me is the fact that the rates of cancer are fairly constant since the 1990s. So we seem to think, because there's so much talk about breast cancer and breast cancer research and screening, that the breast cancer rates are going down, but this is not what the statistics are showing us. So the main risk actually for breast cancer is aging, because we see that most of the new cases, actually over half of the new breast cancer cases, are diagnosed in women between the age of 50 and 69. And only 11% of the new cases are diagnosed in women younger than 45. The point that I would really like to emphasize here is that the role of inherited genetic mutation active in the breast itself is only 5 to 10%. So we tend to think of breast cancer as a very genetic disease in nature, but really we see that only 5 to 10% of breast cancer is caused by inherited genetic mutations. And we see that most breast cells will become cancerous in response to exposure to substances such as bad estrogens, and we'll talk a little bit later about what those bad estrogens are, and more importantly, what we can do to minimize those bad estrogens. So some of the risk factors related to breast cancer, and I've quoted the Canadian Cancer Society, who says that some women develop breast cancer without having any of these risk factors. Most women with breast cancers do not have a family history of the disease. So the good news about this is that risk of breast cancer are not necessarily a fatality. There is something we can do about it. Some of the factors, of course, such as getting older, being a female, not much we can do about. But, for example, limiting our exposure to estrogen and reaching our optimal weight, limit our alcohol consumption, these are all things that we can easily do and that will offer a certain level of protection against breast cancer. So back to the question of the good and the bad estrogen. So a little bit like when we talk about cholesterol, and we'll mention good cholesterol as being the HDL and the bad cholesterol as being the LDL, we have the same situation with estrogens metabolites. So estrogen metabolites is basically what happens once the estrogens have been produced and used in our body. So the body will transform those molecules to the extent where we will eliminate them safely outside our body. So some of the estrogens are called 16-alpha-hydroxyestrone, and these are what we call the bad estrogens. And they're termed bad because they promote the development of breast cancer. And we see that there's a higher level of the 16-alpha in women with breast cancer or who come from families that are prone to breast cancer. On the other end, we have the 2-hydroxyestrone, and these are the good estrogens. And the reason they're good is because they may offer a protective role against women's cancers. And the enzyme making the 16th form of estrogens metabolites is 8 times higher in women that are considered at risk. And this genetic mutation that diminishes the woman's ability to make the 2-hydroxyestrone form, or the good estrogens, will be, again, 8 times more likely to have breast cancer. So we do see that this ratio of 16 to 2-hydroxyestrone is very important in terms of risk of developing breast cancer. Now, the interesting thing about these estrogens metabolites is we do have certain substances that come from cruciferous vegetables such as broccoli and cauliflower that will manipulate those ratios in favor of the 2-hydroxyestrone. So we can diminish the bad estrogens in favor of the good ones. Menopause. So menopause, we all know the famous hot flashes and night sweats, but a lot of other symptoms ranging from difficulty concentrating to palpitations or loss of bladder control are also attributed to menopause. A lot of prescription medications are proposed for menopausal symptoms management, ranging from serotonin, norepinephrine, reuptake inhibitors to hormonal therapy. But what I would like to emphasize with you today is the importance for those so-called solutions to rest on a healthy diet and lifestyle. So as we see in terms of the pyramid diagram, you know, the foundation of your program should be your diet and your lifestyle, and then you can add nutritional and herbal supplements to that. Now, once that has been taken into account and put in motion, if there are still some symptoms, they can usually be managed efficiently with bioidentical hormone replacement therapy. And for those women who still cannot have relief from these three different approaches, then we can move on to hormonal therapy or other forms of medication. But really, it should all start with the diet and lifestyle, because in the same way we discuss medications for premenstrual syndrome, medications will address the discomforts but will not treat the cause. So what are the causes of hormonal imbalance? The main cause is definitely depleted nutrients. So when we are lacking certain substances in our body, it will affect the way we produce certain neurotransmitters. It will affect the communication between our hormones and glands in our body, and this can all amplify greatly the symptoms we attributed to hormonal imbalance. Unstable blood sugar. So your level of sugar in your blood will have also a dramatic impact on how you feel and how you think. The third situation is the estrogen dominance scenario that we've discussed. And the fourth one, which is also extremely important, is the high-stress lifestyle. And the reason why stress is so detrimental to our hormonal cycle is because it affects the state of our adrenal glands. And when our adrenal glands are fatigued and exhausted, it has a very big impact on our hormonal cycle, because we will see that, especially after menopause, our adrenal glands play a major role because they produce over half of our hormones. So imagine if your adrenal glands are already exhausted from coping with stress, then your ability to be producing these hormones will be greatly reduced. So that's why managing stress, especially in these periods of hormonal changes, will become so important. So depleted nutrients. Without adequate supply of vitamins, minerals, and nutrients, you will definitely experience an intensification of hormonal imbalances symptoms. All the symptoms associated to PMS will feel worse, and we see that situation, especially in women in their 40s, and one of the reasons for that is our crazy lifestyle and also the crash dieting. Poor nutrition will physically alter the protein shape in our brain, and these altered proteins will no longer send the proper signal for normal ovulation to occur. And some of the symptoms related to depleted nutrients include poor sleep, and that is very obvious because proteins broke down into amino acid, and some of these amino acids will produce neurotransmitters such as serotonin that are absolutely crucial to the quality of our sleep. Then irritability, fatigue, muscle cramps, and overall worsening of all symptoms. Blood sugar fluctuations also affect how we feel. It's often called the energetic and emotional roller coaster ride because our emotion and feelings are so tightly tied to our blood sugar level. The main culprit here is the excessive sugar and refined carbohydrates consumption, because it does increase the fluctuations in blood sugar, and the symptoms that you will experience go from feeling shaky, lightheaded, dizzy, and have those uncontrollable food cravings, because when you eat those refined sugar, then your blood sugar goes up, then your pancreas has to release a fair amount of hormones to bring that sugar down, so the insulin is being released, and then if you do that over and over, at some point your pancreas becomes overreactive, and you're going to bring your blood sugar down too much, and then you have this state of hypoglycemia, and then of course you're craving fast sugar to bring back up your level of sugar. And this constant up and down of the glycemia is also very detrimental to your adrenal glands. So on top of leaving you feeling not good, it will have an impact on your hormonal cycle. So the famous situation of estrogen dominance that we saw earlier, of course, affects the hormonal balance, and we see here the role of stress. So I've quoted Hans Selye here, and Hans Selye is this Canadian researcher that really studied stress in details, and Hans Selye said that every stress will leave an indelible scar in the body, and the organism pays for its survival after a stressful situation by becoming a little older. So really, stress, I know it's everywhere. Some situations we can control, some are not within our range, but it is very important to bring the proper nutrients and the proper substances to our body to help face those stressful situations. Stress has been divided in 3 phases. The first phase, which is called the alarm phase, is your immediate reaction or response to the stressor in your environment. And the key hormone that's being produced at this time is epinephrine and aldosterone. And basically, what your body is doing at this point is bringing all your resources. So you're going to have an increased energy consumption by your skeletal muscles because you're getting ready to fight or flight the aggressor that's in front of you. So you're going to have an increased blood pressure rate, and everything is going on for you to be able to fight or flight. Then you will reach the second phase, which is called the resistance phase. So when the stressor remains in front of you, and other hormones will now start being produced by your body, such as epinephrine, thyroid hormones, growth hormone, glucocorticosteroids. And what happens there is that we're going to have an increased energy demand. Our glycogen reserves, so our sugar reserves, are basically becoming, over-solicited. And if this phase goes on for too long, obviously we will get to the third phase, which is the exhaustion phase, and that's when our vital systems collapse because we can no longer maintain our hormonal and metabolic demands because the body is undergoing too much stress for too long. So the body is very well equipped to face stressors that will happen, few and far apart. In the old days when we were going mammoth hunting, you see the mammoth, you kill the mammoth, or you run away from the mammoth. The body is very well equipped to face that. The problem occurs when, you're having a mammoth every Monday in your office, for example. So when your body is having to deal with those repeated and chronic stressors, that's when, the problems will occur, because we can face big stressors every now and then, but not constantly every day. This will really, really tax our adrenal glands. So how does being stressed will affect our hormone level? It is because of the adrenal connection. So as we saw, the stress will activate the axis between the brain and the adrenal glands so that the adrenal glands can generate the stress hormones such as epinephrine, norepinephrine, and cortisol. And cortisol is a key hormone here because progesterone is the primary raw material that is used to produce cortisol. So you can easily see now the connection between being constantly stressed and the state of estrogen dominance, because all of a sudden you have no more progesterone to balance out your hormonal cycle because your body is using all your progesterone to make cortisol, the stress hormone. Cortisol will also affect your thyroid gland because it will impair the conversion from the T4 to the T3, which is a more active form of thyroid hormone. Epinephrine, norepinephrine, two other stress hormones, will use tyrosine as their precursor, and tyrosine is the amino acid that is used to make your thyroid hormone. So we see here that stress will very much impact your adrenals and thyroid, and these glands are key glands in regulating your overall hormonal cycle. So that's why a compromised adrenal function will profoundly affect your hormonal balance. Your adrenal contributes to about 35% of your hormonal total before menopause and over 50% of your hormones after menopause. And as we saw the connection with thyroid, overtaxed adrenals can even lead to hypothyroidism. So really, really important to address those stressors in our life. So in terms of achieving hormonal balance, the first thing we will look at doing is replenishing those nutrients in our body and balancing our blood sugar. We need to balance estrogen to progesterone ratio, and one of the ways we can achieve that is by improving estrogen metabolism. We need absolutely to manage the stressors in our life, and we also want to support the adrenals and thyroid because they are, the sentinel organs that have to be facing those stressors in our life. So in the same way that we discussed with PMS symptoms and menopause, the way we want to achieve hormonal balance is first and foremost by addressing diet, lifestyle, and stress management. Then we will improve detoxification, and we will bring in nutritional supplements that will address those four issues that we just discussed. So in terms of diet, what we want to do is adopt a diet that is very similar to a diet you would adopt for hypoglycemia or diabetes, which means eating smaller and more frequent meals. And that really helps keeping your blood sugar in balance. And you want to make sure that you have sufficient amount of proteins in those smaller and frequent meals. You want to strive for a healthy dinner before 7 p.m. Eating too late will really impair your detoxification capacity. So it's very important to try and eat your last meal before 7 p.m. You want to limit salt and salty foods in your diet because they will make you retain more water. You want to choose foods that are high in complex carbohydrates. So we said that carbohydrates affect your blood sugar. Now the complex carbohydrates are those unrefined or complete cereals, and these are good for you. You want to choose foods that are rich in calcium. Calcium is very important, especially in terms of PMS, and of course we all know the role of calcium in preventing osteoporosis and osteopenia. And we want to avoid caffeine and alcohol intake. We need to understand that all stimulants, such as caffeine and alcohol, will be perceived as stressors by the body. Same thing with eating disorders, crash diets, drug use. These are all major stressors for your adrenal glands. In terms of lifestyle, well, of course, exercise. We've seen the role of exercising in every single webinar, and the reason for that is because it will improve your overall health. And 30 minutes of aerobic activity can help diminish the symptoms of fatigue and depression, among other things. But really, the role of exercise is never emphasized enough. We see that exercise can also counteract the normal shrinking of our brain. It will also help in reducing osteoporosis and osteopenia, like really, really important to emphasize the role of regular exercise. In terms of stress management, well, we want, of course, to make sure that we get plenty of sleep, limit the use of computer and TV no later than 8 or 10 p.m., no TVs in the room, very important. And if we can incorporate some form of either muscle relaxation, deep breathing, exercise, meditation, Pilates, one form of another of stress management, as long as we find one that suits our needs, and that can have an impact on reducing headaches, anxiety, and insomnia. Maintain and strive to achieve a healthy weight is also very important because adipose tissue act as reserve and promoter for estrogens. Quitting smoking, and it is also a good idea to record your symptoms for a few months in order to be able to identify maybe certain patterns or certain triggers. In terms of stress coping strategies, I would like to invite you to take the Stress Vulnerability Self-Test on AOR's website, just to see where you're situating yourself, and maybe redo the test after a few months once you've addressed certain factors in your life. And I think the most important thing in terms of stress coping strategies to realize that you are in control of your life. So there are a lot of things you can do to minimize the impact of those stressors. And of course, there are certain stressors that we cannot change, and so in that case, it's useful to adopt the adaptogens, so those substances that can support our adrenal glands and thyroids to better face the stressors in our life. Third point we like to look at is detoxification. So detoxification is quite a complex process, but in a sense, what it's trying to do is convert those fat-soluble toxins. So the majority of our toxic load is initially fat-soluble, and the liver wants to transform those fat-soluble toxins into water-soluble substances so that a body can excrete them safely through the kidney. What's important to understand about detoxification is that the body needs specific nutrients and also energy to support the detoxification process. The most important vitamins in supporting detoxification are the B vitamins, and more specifically, vitamin B12, B6, and folate. Antioxidants are also paramount because once we transform the substances in phase 1, which we will see a little later, they produce a lot of free radicals, and we need the antioxidants to buffer those free radicals. Then we need sulfur-bearing amino acids, such as L-cysteine, to support specific pathways, such as sulfation, in our liver. So we see it a little bit more graphically on this slide here. So phase 1 is where the toxins are being prepared for elimination. So it's on the left side on the picture we see here. And phase 1 is dominated by cytochrome P450 enzyme system. So basically what we do there is we will metabolize substances such as drugs and toxin and hormone, and basically make them ready for phase 2. In that process, we will produce harmful activated intermediate metabolites, and these metabolites produce a bunch of free radicals, and that's why the antioxidants such as vitamin C and vitamin E become very, very important. Otherwise, we are basically creating more damages than initially. And then the toxins are sent in phase 2, and phase 2 is where the conjugation occurs, or the addition of a chemical molecule to those phase 1 intermediates that our liver has prepared for us. So we will add, for example, sulfhydryl groups or methyl groups to the phase 1 toxins. And some substances are very interesting in supporting phase 2, and they're called sulforaphanes, and they come from cruciferous vegetables. And they are particularly useful in detoxifying hormones from our body. In terms of nutritional supplements, what we want to do with the supplements here is first replenish the nutrients and balance blood sugar. 2, we want to balance the estrogen and improve estrogen metabolism. Then we want to manage stress, and we want to support the adrenals and the thyroid. So let's have a closer look at which supplements can be useful in addressing those cornerstones. So the vitamin B complex. So vitamin B for me is really very, very important. You know, we tend to like a lot vitamins such as vitamin C and vitamin D that is very popular over the years, but vitamins B are really, really understated, and they're so paramount because they are involved in just about every system in our body. Now, what is important about a B complex is you need to have, first and foremost, a B complex that is where the coenzyme forms of the vitamins can be found. So, for example, the coenzymatic form of pyridoxine or vitamin B5 is pyridoxal 5-phosphate or P5P. And this is important because certain people suffer from what we call polymorphism, or certain minor genetic modifications that do impair their ability to convert the vitamins that come from their diet or from regular supplements into this active coenzyme form of the vitamin, and therefore they will not be able to carry the functions attributed to these vitamins quite as efficiently. So in the case of P5P, we see that it's absorbed 3 times better than pyridoxine, so than regular conventional vitamin B6. And this coenzyme form is involved in 113 enzymatic reactions. So imagine for this person who has a problem converting pyridoxine into pyridoxal 5-phosphate, that means there can be an impact on 113 different enzymatic reactions in your body. Now, vitamin B6 is particularly interesting in terms of women's health because it is, among other things, involved in amino acid metabolism. So we need vitamin B6 to produce neurotransmitters such as serotonin and to produce tyrosine, which is needed by our thyroid gland. Vitamin B6 is involved in fatty acids metabolism. Now we saw that steroid hormones such as estrogens and progesterone come from cholesterol. So we need a vitamin B6 in order to be able to produce those hormones in our body. It's important also in heme synthesis, so that means in terms of producing healthy red blood cells. It's important in our methylation cycle. Methylation cycle very important in terms of removing homocysteine, which is a toxic residue in our body that can lead to different heart conditions. So a deficiency in vitamin B6 can be identified by, for example, premenstrual tension, water retention, depression, insomnia, so on and so forth. So we see that a lot of the signs of vitamin B6 deficiency are overlapping with the symptoms attributed to premenstrual syndrome. So vitamin B6, again, is involved in the production of steroid hormones, and P5P also binds to steroid receptors in a manner that inhibits the binding of steroid hormones, thus decreasing their effect. So that becomes interesting in terms of overstimulation of those receptors, such as in the case of breast cancer. So the binding of P5P to steroid receptors even suggests that the vitamin B6 status of an individual may have implications for diseases affected by steroid hormones, such as breast cancer. So other benefits attributed to vitamin Bs as a whole, energy production, very important. So the way the body uses the carbs and the fat has to do with our vitamins B level, B1, B2, B3, B5, for example. Maintenance of muscle tissue, migraines, neurological health, and so on and so forth. So really, I would say that up to 80% of the patients that I see in consultation leave my office with a vitamin B complex, or I can also recommend the OrthoCore. OrthoCore is the multivitamins, minerals, and phytonutrients formula that we have at AOR. And the very interesting thing about OrthoCore is that it does include the vitamin Bs in their active coenzyme form, as we just saw, and also in the proper ratios. So it's important to have the vitamins in the proper form, but also to have the proper ratios. And certain companies will have, for example, all the Bs in like 50 milligrams, but these are not the proper ratios our body needs to function optimally. So in the OrthoCore, as I said, we do have our Bs, but we also have all the important antioxidant complexes. As we saw, antioxidants are also very important in terms of supporting a healthy liver detox. And in the antioxidants, I would like to point out our vitamin E complex that is comprised of the 8 different molecules of vitamin E. So very important to have all 8 molecules in the 2 families, the tocopherols and tocotrienols. Also, the OrthoCore has advanced antioxidants such as the grapeseed extract, alpha-lipoic acid, the EGCG that comes from green tea, and so on and so forth. So very interesting multivitamin. So now, for me, the way I make my protocols, I want to make sure that I address the foundation nutritional needs. So I usually start with the OrthoCore or the Advanced B complex as my foundation on which I will build with other supplements. The second supplement I would like to discuss with you is Gamma-linolenic acid, or GLA. And basically, this is a fatty acid that comes from evening primrose oil, and in this case, from borage oil. So GLA is important because it helps modulate the body's balance of eicosanoids, and it's involved also in the steroid production and hormone synthesis. In clinical trials, it's been shown to improve some of PMS symptoms such as nostalgia and depression. It's also been involved in menopausal symptoms management. GLA is also good to reduce pain, swelling, and water retention associated to inflammation, has a role in immune function, nerve transmission, eczema, atopic dermatitis, etc. So also very interesting supplement for women at different stages of their life. Now the estrogen metabolism. So we've discussed in length this condition of estrogen dominance. So what can we do in order to make sure that we detoxify those estrogens efficiently from our body? We have a combination of 4 very interesting substances that is called estro detox. So the first substance in estro detox is calcium deglucarate. So calcium deglucarate is involved in one of the phase 2 pathway called the glucuronidation pathway, where we detoxify toxins, carcinogens, and hormones. But more importantly, calcium deglucarate will have a role to inhibit the enzyme called beta-glucuronidase. And this enzyme, what it does is once the body has managed to deconjugate our hormones, the beta-glucuronidase may put back the hormone together and recycle it. So it has a reactivator role in our body. So of course, it is very counterproductive. The body's trying to eliminate, the estrogens, and the beta-glucuronidase will just put back and recycle the estrogens in our body. So calcium deglucarate will have a blocking effect on this beta-glucuronidase enzyme. So that is a very interesting substance. It has been shown in clinical trial to diminish serum levels of estrogen and diminish the breast cancer cell development by up to 70%. There's currently studies in women at risk for breast cancer, and we think that calcium deglucarate is on its way to become a safe, effective, side effect-free alternative to the drug tamoxifen. Second substance in the estro detox is sulforaphane. Sulforaphane is a natural antioxidant that we find in the cruciferous or brassica family of vegetables. It's a potent inducer of phase 2 liver detoxification enzymes, and it inhibits the proliferation of breast cancer cells. So sulforaphane is a very well-studied substance, and we see that it is involved in more and more trials and in more products. Another interesting substance is 3-diindolylmethane, or DIM, and DIM is also found in the brassica or cruciferous vegetable family, and the role of DIM is to increase the 2-hydroxyestrone, so the good estrogen metabolite versus the 16-hydroxyestrone estrogen metabolite. So it will shift the balance in favor of the good estrogen. So that is very, very interesting. In clinical trials, we've seen that DIM has the ability to stop breast and cervical cancer cell growth, and it will help activate some genes that help prevent breast cancer as well. Very interesting study done on cervical dysplasia. Phase 3 clinical trials has shown that it can revert the precancerous cells in the case of cervical dysplasia. The fourth ingredient we find in the estro detox is actually a standardized ops extract that's named Lifenol, and Lifenol has been involved in several clinical trials. It is a potent phytoestrogen. It is equal or more potent than genistein that we find in soy, and it will stop breast cancer cell proliferation. It prevents angiogenesis, so that's a process by which the cells, cancer cells, will bring the blood vessels to them to feed themselves. In menopause, it diminishes the hot flashes, the night sweat, and other symptoms. And it may also prevent cardiovascular disease associated with low estrogen levels. The next substance in terms of estrogen metabolism is indole-3-carbinol, or I3C. And I3C is the key active cancer-fighting ingredient that we find in the brassica family. I3C is broken down into DIM, but I3C is definitely the substance where most of the research has been conducted. So if you take I3C, your body will convert it into DIM, but some of the metabolites are also important. So DIM is an important substance, but in my opinion, the ideal scenario is to combine I3C with DIM so that you have extended benefits. And I3C is another one of these substances that will shift the balance of 2-hydroxy estrone versus 16-hydroxyestrone, so you're placing more emphasis on the good estrogens. It will halt the cell division and kill existing breast cancer cells. It will increase the expression of BRCA1, so that gene is very, very important in terms of breast cancer, because we see that 85% of women who carry a mutation on that gene will develop breast cancer at some point in their life, and 60% will develop ovarian cancer by the age of 70. So to have an actual compound that does have a positive effect on BRCA1 is, of course, very, very interesting. In another study, we saw that I3C has reversed carcinoma in situ of the cervix in 47% of the women, and that is without the use of surgery, freezing, or laser therapy. So again, very, very interesting substance that nature has provided us with in terms of preventing breast cancer and all other feminine cancers. Serotonin. So level of serotonin is very important in our body, because low levels of serotonin are associated with depression, anxiety, insomnia, migraine headaches, some obsessive-compulsive disorders, food cravings, and so on and so forth. Now, the problem with serotonin is we cannot give it as a supplement because it does not cross the blood-brain barrier. So instead, what we can do is to provide the body with 5-hydroxytryptophan, or 5-HTP, because on this form, it is very well absorbed. Actually, 70% of 5-HTP will penetrate the blood-brain barrier and be converted into serotonin. Now, Griffonia simplicifolia is a small shrub tree that grows off the Ivory Coast and Ghana, and we can extract 5-HTP from its seed. 5-HTP has been extensively studied. For example, in terms of depression, over 19 studies have evaluated the clinical effects of 5-HTP, and what we saw is that in half of the patients, the symptoms were improved after only 3 days of using 5-HTP, while 80% saw an improvement within 2 weeks. Now, that is extremely interesting, because we know that conventional antidepressants will usually produce their effect between 4 to 6 weeks after the initial start of the product. Now, 5-HTP provides results within 3 days, and 8 out of 10 people will actually see an improvement of their condition within only 2 weeks. So that is very, very interesting. 5-HTP is useful in terms of insomnia, and it has also been studied in the case of migraine. And in the migraines, it has provided results comparable to prescribed medication. So very interesting substance. The next substance I would like to talk to you about is theanine, and theanine is an amino acid that primarily comes from green tea. And the interest of theanine for me is the fact that this is an extremely safe, side effect-free, and a substance that has very few interactions with other medications or substances. We even use theanine extensively with children, for example, hyperactive children. So when people are on different type of medications, I will usually start with theanine as opposed to 5-HTP, just because of its safety profile. Now, the role of theanine is really to support the alpha wave brain activity, and those alpha waves are associated with the relaxed and peaceful alertness experienced during meditation. So what theanine does is basically increase the state of relaxed and peaceful vibe in your body while keeping your mind very alert. So it's not a substance that will induce sleep, for example, like valerian. It will just make you feel relaxed, but it will make your brain very alert because it improves the metabolism of dopamine as well as serotonin in your brain. So it will improve your learning and ability to memorize things. It will also protect your nerve cells against certain excitotoxins, for example, stress hormones such as norepinephrine. And it acts very quickly. 40 minutes after its ingestion, you can even open the capsule and it will act even faster. In terms of adaptogens, well, the adaptogens are natural substances such as herbs and glandular extracts that will help increase the capacity of the body's stress system to maintain its homeostasis or its state of balance equilibrium during exposure to stressful conditions. The way the adaptogens will accomplish this is by helping the body to maintain its stage of resistance. So we saw that in the alarm phase, the hormones are produced in big amounts, and then we reach the resistance phase. So the adaptogens will help you modulate the production of the stress hormones so you don't go too high, and it will extend that resistance phase so that you don't become exhausted or collapse quickly. There's a very interesting formula at AOR called OrthoAdapt, and OrthoAdapts combine certain vitamins that are very helpful for the adrenal glands, such as pantothecane, which is the coenzyme form of vitamin B5, vitamin C, and a combination of different herbs that are known for their adaptogenic capacity. For example, rhodiola, ashwagandha, licorice, and Siberian ginseng. So all these herbs have been used traditionally to increase the body's resistance in face of stress. And so the vitamin B5, vitamin C, and the adaptogenic herbs are combined with adrenal glandular extract. And the glandulars are important because there are peptides and nutrients cofactors that are required for the adrenal gland to carry out its biological function. And what I like a lot about this extract is that it combines both parts of the adrenals, so the cortex and the medulla. I have seen really interesting results, both in terms of prevention, so when people know they are undergoing stressful periods, such as exam periods, and also when people have already reached the exhaustion phase, which we commonly call burnout. OrthoAdapt works very nicely. Now, for those people who would prefer not to have the glandular extracts, we have a formula that is glandular-free. But by and large, if you can take the form that has a glandular, I would say that it produces superior results in a shorter period of time. Maca is another herb that is known for its adaptogenic capacity. It's found in the Peruvian Andes, and it helps balance major steroid hormones such as estrogen, progesterone, and testosterone. And it has been shown in different clinical trials to diminish menopausal and premenstrual symptoms. It helps increase the stress coping mechanisms and energy. Now, we saw earlier that there's a very strong connection between the adrenal glands and the thyroid gland, and so it is often necessary to support both glands in terms of reestablishing the hormonal balance. And I've also seen clinically a big difference once I've started supporting both glands at the same time. And thyroid is one of these glands that is a little bit tricky because the different testing that is being performed is not giving us the results that we would expect. So I would say even preventively, and even if your test results are normal in terms of thyroid, if you do have some clinical signs of thyroid dysfunction, by no means you should really try to incorporate the supplements such as thyroid support. Thyroid support combines tyrosine, so the amino acid that is essential to thyroid hormones production, iodine, which is also part of the atomic composition of T4 and T3, choline, which is a herb that I've grown very fond of. It's found in the Ayurvedic pharmacopoeia, and its active ingredient is called forskolin, and forskolin helps produce and release the thyroid hormones, and it's also an enhancer of cyclic AMP. So it acts on the regulation of cellular function, energy expenditure, and it is also a hormonal response modifier. So very, very nice formula to consider when we want to reestablish hormonal balance. So that is it for today. I would like to invite you to also listen to our other webinars that are archived on AOR's website, and all our webinars are available both in English and in French. So again, my name is Chantal Anzuma. It was a pleasure to host that webinar on women's health with you today.